So we are ready for our session after 2 weeks. We had a break last time. Yeah, we didn't want any of you all to miss. So I just hope everybody comes today, since they all asked for a break last time. So we are on NJ CME number 13. And we are going to have an exciting Fabels. As I told you, Fabels is a very large group. And I prefer still to call it leguminales because it reminds you quickly of the pea family, which, splits and separates and you can't put it together again. So we have finished roses, we've done marigold, and we are doing Fabels. So in Fabels, all belong to the Rosidea, and you remember what all we have done. We've done balsamum, we have done Mary Lotus, we have done Miserium, we have done Lathyrus last time for paralysis, we have done tamarind, we've done soya, we have done robina. Robina is mainly malaria miasm with the pea family. We did a case of two partners coming and fighting, and the fellow on the seat getting very scared, never knowing when they will come again. Finally, he left the job and got another good job. So malaria miasm is when they come again and again, and when they're going to come, and leaves you all the time very scared. So today we are going to do some very exciting things. One is we've called Dr. Priya Subramaniam, very, very good friend of mine. And she helps Dr. Mahesh Gandhi do his ITC, what we call in the clinic cases, and very particular person, very fastidious. She says 10 minutes and is 2:12. Now she will say we will meet at 2:22, not 2:20, not 2:30, not 2:25, but 2:22. So I've never seen such a particular disciplined person in my life. So we're going to have her today with us, and she's going to share some very exciting cases with you. So I'm not going to tell you which case, so let us see what she says and whether we can guess any of the remedy we have done. So, Dr. Priya, you're there. Preeti, will you allow her to share, please?
Good afternoon. Yes, I'm here. Can you hear me?
Yes, Priya, I can hear you. You're nice.
Good afternoon. Thank you so much, Dr. Vishpala. It's very encouraging.
So,
like me to share?
Would you like to share? There, I can see.
Do I share my video also? Or
I'm stopping my share screen, okay?
Sure. Yeah. Sure. You will have to allow screen sharing, please.
Yeah. Preeti, please allow her screen sharing.
Better. Can you see my slide?
Yes, thank you.
All right. All right. So thank you so much, Dr. Vishpala. I really admire you very much. I can never forget you attending an ITC session from the
The voice is not
hospital
very
bed.
clear, Priya. Preeti,
Wait, let me increase.
about it. Voice is not clear.
Can you hear me better now? I increased my system
Yeah,
volume.
the last sentence was better.
All right, all right. Is this better now?
Yeah.
So I was saying, thank you very much, Dr. Vishpala. It's very, I really admire your spirit to learn. And as the oldest homeopathic, you certainly are the most energetic. So when you said, please come and show some cases, I said, of course, I must. And fortunately, I did have a couple of them. And as I was saying, I can never forget you attending an
Better, but
ITC
the voice
session.
is still not very good. Preeti, can we do something?
Yes, ma'am.
It's still not absolutely clear all the time. Any reason?
Ma'am, I didn't get you. Sorry.
Am I only finding it, or everybody's finding the voice not
No,
clear?
your voice
Your
is
voice is
breaking.
clear. Your
Priya's
voice is clear. I can hear
breaking.
you.
Your voice is clear, madam.
My voice is clear. Priya's
Yeah.
voice.
Breaking, yes. Now there is no voice, Priya. There is some issue.
Nirupama, your voice also was clear. So why
You can log out and log in again.
Is
Dr.
my
Priya can
voice
log out.
clear now? Is my voice clear now?
Yeah, now it's clear.
All right, some issue with the Bluetooth. No worries. I can speak like this as long as I'm audible. I hope that my gratitude to Dr. Vishpala was audible. Otherwise, I will repeat it for the third time.
Please
Good
repeat,
afternoon
Dr. Priya.
to you.
Please repeat. It wasn't audible.
Okay, Dr. Rama. I said, thank you so much, Dr. Vishpala, for having me over. And I really admire your spirit. As the oldest, homeopath in our group, I can never forget the time that you attended an ITC in the clinic session. From the hospital bed, you still insisted that you would attend. I can never forget that. It certainly gave us a lot of hope that we would also be very active, with our advancing ages, if the intellect permits as well. So thank you so much. And fortunately, I had a couple of cases today. So I'm here. And so as Dr. Vishpala was saying, generally what we do is we use is my screen clear?
Yes, yes. But
All
you
right.
can make it full screen if you want.
All right, I'll do that. Is that better? All right. Is it now full screen? Can you see?
Yes, yes. Thank you.
All right. So what we are also doing in a small group that I have once a month called as Vital with Vitalia is we've been exploring the plant Yakit plant chart as well. And we are currently in the subclass 6. So we began our exploration around two years ago. So we also follow this way. I really like for somebody, as Dr. Vishpala calls me, fastidious. For me, it seems a very organized way of studying remedies. If you have them in charts and then you can, at a glance see where a particular family is depending upon the inner age. And, it makes things very organized, very easy. And it's a very fastidious way of studying as well. If you can think of putting plant groups into, particular boxes, but as you can see that you can't really do that. The rosids are a very, very big order. And in that, as per the inner ages, the first row of the womb, you have the rosalis and the myrtalis. But you can see again that in the second row, the oral stage, also you have the myrtalis. And so it only goes to show that the human endeavor is to put the plant families into boxes, but their own development actually, can exceed it. You can see various features of the oral age as well as the anal age. And you can see a mix of those features in your patients. But by and large, the themes generally definitely hold true. So, in this Fabalis, there are several plant families. We will see them presently. The main important thing which you will see is that they all have a very characteristic fruit structure It's a longish pod with seeds in a single row. And to Yakir, this symbolizes the family, the close-knit family, very close and very strong family ties. So this gives us a very good clue, because nature is generally very intelligent in a and we can extrapolate this to understand that if we have a patient who's talking about, family ties, how they were before, how they are now, and if something has happened to affect that close family tie, then generally you get a pinpoint or you get a flag that you might consider. If the plant sensitivity is there, going on further, you might consider subclass 5 and you might consider the Fabalis. So this is what this represents. And this is a very, I would say, sublime a kind of extrapolation to understand that if the tree is true in nature, then it could be very well true, in our patients. So we have a lot of trees in this group, but mostly shrubs. One of the other beautiful things is that they all live in symbiosis with certain nitrogen fixing bacteria, which are present in the nodules along with fungi. So in the root nodules, you have a lot of nitrogen fixing bacteria. So you have certainly a theme of being nurtured by the other. This bacteria help fix the atmospheric nitrogen in a bioavailable way so that the root of these trees can pick up that nitrogen in order to make the nutrient rich, the protein rich peas that which we all know, and very, very nourishing. We certainly on a daily basis, we must be eating one or the other, either a pea or a dal or a lentil from this family for sure, across the South Asian subcontinent and quite all over the world also, because mostly everyone drinks soy milk these days. So one of the other things to understand is that if the legumes themselves are very rich in proteins, and we are talking about some sort of assimilation issue also, you can have a very rich nourishing substance, either it is absent or it is not being metabolized properly in the body, leading to a lot of symptoms. So you definitely will see these symptoms also coming up. There'll be a lot of tendency to stomach issues. Because of malabsorption, there'll be a tendency to malnourishment, malnutrition as well. So you will be able to see these themes very clearly. Now, if we'll see, the main families in the Fabaceae are the Mimosaceae, Caesalpinaceae, and the Fabaceae, also called as the Papilionaceae, because the flowers resemble butterflies in the petal patterns. So as Dr. Vishpala said, that I see that many of the remedies have so far been covered. There are very interesting families, a lot of important remedies in this group. And if you will see, this Fabaceae family has, though clinically, the most important remedies as well, a lot of them. So it's a group that asks for very close study, and will certainly a lot of acute prescriptions, in your clinics. They're very important remedies from that group. Coming to case 1. So this is an acute case, but we will see that the themes are overarching and going towards, maybe looking at a constitutional prescription as well. So there's a 30-year-old woman who came with fever of 3 days duration. All the other investigations were very normal. We were waiting the Vidal test. There was a sort of a false positive, maybe a negative, we weren't very sure, but we would repeat it, we said. But in the meantime, we had asked about any history of travel. This was about 2 years ago, I think, maybe 18 months ago. The fever was not very high. So, one second, I skipped slides. The fever was not very high, and it had begun with a sore throat. The mouth has a lot of ulcers. The tongue was very dirty, coated dirty white, a lot of smell in the breath. So you note that there is some fetid process, some toxic process that is going on in the GIT. Hardly any thirst. And there were chills which came on in the afternoon. Just as an aside, anything else that happened, anything else has happened when, when I asked, the husband said that, yes, she had lost her father some maybe 3 weeks ago or 15 days ago. And, the funeral and all those things were done. As it so transpired that, this would be something very important, as I would understand later on. Now, she had a very good relationship with the father. Husband said that she seemed very little lost and confused after the father's death. But you can kind of, I also put it down to the normal grief. He also put it down to that. It was not a sudden death, so it could not have been like a shock that had happened that to cause this, but he had been ailing for some time. Now, this patient and her husband were also in the process of a divorce. It was going on at that time. They weren't really sure. The father-in-law's death had put, sort of a hold on the proceedings. The night before, in fever, however, although the fever was not very high, she suddenly laughed and she said, "Can you get my hands? I can't find my hands." And he saw that she was trying to look all over the bed for her hands, and this really spooked him because he didn't understand what was happening. And today he said she seems very drowsy, but yesterday night I got really very scared because when I asked her again and again, she seemed very drowsy, a little out of it. She was, acting a little drunk maybe, but I have never seen her like that. And she couldn't understand the question, what was happening. And by this time, of course, with the acute prescription, we knew that if you're waiting for a Vidal test, the test, you're not sure, there is no other history of travel, all of these things have happened. And this body parts scattered kind of symptom, she gave it to us on a platter. So the important rubrics were the fetid breath, fever with chill in the afternoon, answer slowly. And, this delusion kind of like body parts are scattered and she was trying to get them. She couldn't find them. So given in a slightly different way, not your classic way that generally the keynote is. So the remedy is very obvious. Baptisha 200 was given to her almost 2 hourly. And immediately the sort of the toxic look came down. The thirst improved. She started asking for food and she started eating. Then she went off to bed. I think we continued to repeat it 2 hourly. And then when she improved and there was no further spike in fever, it was made 3 hourly. I think within 24 hours, she made a very good turnaround. And then it was very strange when I was looking at Yakir's, description of the Baptisia, the larger picture of it in the shadow of the themes of, the family itself. We know in acute that it is for congestion and dryness of mucous membranes. Clark's Materia Medica does say that it is for the look in flu where you're dull, hot, thirsty, the kind of very toxic kind of distorted kind of look, kind of congested face and not quite there kind of. But Yakir says that it is indicated in adults whose families were suddenly dispersed. Now, can you imagine that there are close ties within a family, and these ties actually, they nourish us at a very deep emotional level. And in the fifth subclass, we know that the emotions are slowly now going to get suppressed and repressed because the masculine intellectual part is now going to begin suppressing that. Because subclass 5, the entire drive of that column is about suppressing the femininity, suppressing the emotions, suppressing the heart, and putting the heart and the mind out of balance and using the intellect for everything. And the energy thinks that perceives that this is the most effective way of being very active or being setting foot in the outside world and being very masculine in your doing. So you can find that the ailments from long-standing divorce of parents, and this is an adult in the 30s and has never been well since. Where siblings are very violently separated in a kind of, in India still we don't see that, but where, siblings are separated from each other, but in a kind of a care-like system, foster care-like system in the United States or elsewhere, for instance, if there is a issue in the family and the parents are separated, then the children are usually placed separately from each other with different foster families. Can you imagine that if you don't have that emotional closeness or bond, and then one by one, the closest bonds in your immediate family, either the bonds are breaking suddenly or they're dissolving, or that family structure where you're, so emotionally dependent on that still. Because let's not forget, this is an earlier row. The masculine has not completely kind of suppressed the feminine, that the intellect is able to carry the weight of everything, as you will see later on in the school age onwards. So here it becomes a very important thing that throws things into disarray. Life is never the same. And children definitely get ill when the parents are estranged. And this 30-year-old woman was behaving like a young child. Father has died, so that's one important relationship. Siblings, I don't know. And then you're looking at a possible divorce with the husband. That's another very important tie that is now breaking. So it's kind of as if the rug is being pulled from under your feet, emotionally, so to speak. So a simple sore throat, which began as that, went into kind of a toxic kind of thing where it was just beginning to be maybe a typhoid. We don't know. Because, long before the positive results came for Vidal test, she was certainly out of danger and she was on the mend. So it's a very important remedy. But you can see that in the background, perhaps this is also constitutional for her, that this remedy was probably needed for her to kind of, if it was a toxic relationship, to get out of it, to kind of pull herself together. And after her father's death, these are all very in a response to the disintegration that she was seeing in her life. Maybe this remedy gives that healing energy. It brings up that fever, it removes the toxins from the body, and it kind of sets her on a path wherein she can look at herself, take a balanced view, not think with the head, maybe allow herself to think with the heart, maybe reconcile with the husband. Whatever the energy is necessary, which is healthy for her at that time, it would have been good for her to do it. Now, she does stay in touch once in a while. They are still kind of ongoing processes going on. But I can certainly see that there is a lot of clarity in what she must do. She's not really lost like before. And this important thing of, not being able to get the body parts together and that they were scattered, if we kind of extend this a little bit, you can even think of, like a schizophrenic state. If there is a deep trauma and a family is scattered, somebody might lose their bearings on their sanity also. This can happen because we are talking about the subclass 5. It can be, even for Alzheimer's in women who have always been restrained and held back and kind of controlled by their husbands. And suddenly that husband dies, they're kind of adrift in life. They don't really understand what's happening and they can't really get, a handle on their lives. It can be like that also. So a woman who has never expressed herself emotionally has always been suppressed by her husband. And, after her husband's death, she finds that, she's no longer able to manage things. You can also have somebody who's had a baby recently, postpartum blues. It's a very important, very difficult pregnancy. And then you have a child slightly later on in age, maybe in your late 30s. And after that, you're not able to understand what is this new family structure. And before the bonds with the child develops, you can be a little adrift in life. Postpartum blues also, it is a very important remedy. We know that it is a very important source of the blue pigment that we generally, dye our clothing with. It has antibacterial and antifungal properties as well when it is used as a vegetable dye. And the symptoms develop slowly because it's an earlier row. So the vessel is not yet fully that mature that you can have very clear-cut symptoms very fast and with a lot of clarity. Because in Baptisia is still in an earlier row, the vital force is not really that strong. But something like the illness of a family member, sure, it would set us all array, a kind of throw us all out of uh, routine, but here it seems to have a very kind of toxic effect on those who would respond very well to baptisia. Can also be somebody who's newly leaving home, separating from family, as a children of parents who are always squabbling and fighting. It can be in that kind of situation also. A toxic kind of atmosphere where there is nothing nourishing emotionally for the child, to the growing child. Or the father is leaving kind of, picture can be there. And this can even lead to a kind of splintering of the personality itself, the schizophrenia kind of picture. And they can spend a lifetime maybe gathering the pieces together, but not able to. This kind of thing, if you will see in your patient who comes with, your kind of psychiatric illness, you can also think of the baptisia, the whole Fabaceae family also, and look at what else is important. Uh, when we say that nourishment is both from the father and from the mother, why is it specifically the father leaving? It's because the column 5 it's about the masculine force. It's not about the feminine force in life. A father is generally considered to be the kind of emblem or personify the masculine force, which gives you a kind of direction in life. And subclass 5, the entire column is about finding one's direction in life and moving forward and achieving things with the limbs in the world. So baptisia becomes a very, very important remedy in that case. As I was saying, you can even see depression kind of features. And they can be, because it's an earlier row, they can be a kind of propensity for being abused, the boundaries being crossed, and somebody doing something to a very vulnerable person. And the effect of that abuse is that there is a toxic kind of stuporous state, and not really any coherence in the mental state, and a lot of emotional hurt which cannot be expressed. That kind of thing also you can see. Or they can be something like a melilotus, where there is a violent kind of response to that perceived abuse or hurt or insult. This can also be there. So baptisia and melilotus generally, and robinia generally, the remedies come, they're very, very close. They're also related, but because on one hand, baptisia shows very well the toxic stuporous kind of effects. Melilotus shows a very acute kind of acute mania, kind of breakdown of the psyche and danger from the family kind of picture. Robinia has more to do with a kind of much more grown up adult kind of picture, having issues with the partner, like Dr. Vishpala was saying, when we initially began. Kind of fights which happen with the partner, and one of the partners not able to understand how to manage this. Okay. So one of the things is, one of the phrases that I really like that Yakir has used is that this person was all over the place, literally. So you can also see that when that kind of scattered outlook, not really able to pull things together and function, is also when you can think of the Fabaceae. All right. The things falling apart in their life, opium would be very different. But Yakir compares it to opium also. Opium will be completely benumbed and as if, buried alive under the force of all of these feelings that cannot manage. So when we're looking at one of the other, remedies I was asked to share, this is also, I had taken it as a kind of acute case. But once I, made the prescription, it was kind of very interesting to see that the other themes also fit in, and it was a very good understanding of subclass 5 that I got. So it's a 50-year-old man. He came with symptoms of gastric headaches. He had unbearable acidity. He could not eat anything, even the simplest of things. There's a lot of heartburn since a month. So they did a gastroscopy, and there were erosions in the esophagus. They could not go beyond that because they felt that, they should first take care of it. He got very frightened by the prospect of getting more investigations done. The medicines were not really suiting him. So because his wife was a patient, he also came. There was a lot of acidity, aggravated after meals, aggravated lying down, especially in the evening, especially in the night. Says even the back teeth they ate because of this, all this acid which is coming out. Now, I knew his wife. She was doing very well on her remedy for diabetes. So I know from her that he was recently retired. He was working at a bank or some sort of business, and he was managing a team of people. And either the business or something happened to the bank, and some bankruptcy or something was there in the background of that story. And the kind of he was let go, or he was asked to retire because he was closer to retirement age in that organization. So he just couldn't overcome that. He's, when I asked, he was very matter of fact. He said, we had a very good team. We were like a family. We solved each other's problems. I used to take very good care of my team. They were all quite younger than me. So he says, now I'm home. I'm looking for work. Who will hire me at this age? And his wife was working in another bank, and she was in a very good job. And so she was basically running the house. So he would drop her and he would pick her up, he would drop her, he would pick her up, and, come in the evenings and things like that. So he was now she was the breadwinner of the family, and he was doing all the things, he was making breakfast, making dabba, all those things suddenly. So he says, I do most of the housework. And he kind of gave a laugh, and I remember it was not a very happy laugh. So he was, because she was earning very well. Says, I'm not even able to eat simple foods. I don't know what to do. He's losing a lot of weight. They had checked for the diabetes, but he didn't have that. So how tomorrow, if I get a job, how will I manage if I lose my strength like this, if I lose weight like this? But he would crave a lot of chicken, but then, as a very strict Maharashtrian, she would eat it only at particular times. And then he was finding it that I need that little bit chicken, I need that little bit something to put on my weight. And she's saying no. And, what do I do? That kind of thing. And little kind of thing, but he was not speaking up what he needed. He says that next year, they had grown up children, son and a daughter. Daughter was still studying some BCom something. Son was going to get married. He had a job already. They had met that girl, and he was thinking of settling down. They needed money for the wedding. That family had come to meet. So he says, should she take care? Sometimes I feel like that I should first find a job, then maybe I can ask her to take care of the household, because I'm not really cut out for doing these things. And he says, but she gets that benefits, health benefits, and all those things, he would talk. So she also was doing very well at her work. She's a go-getter. She's doing nicely in her job. So she would obviously not be ready to leave, her job. So he would get a lot of evening headaches. Okay, and they would be, by the time that he would have to go and pick her up from the station, from her work, he would get headaches, and they would be aggravated by motion. So he would say, maybe I'll not come to pick you up or something. And this would lead to kind of arguments between them. So for me, the first prescription was quite clear. I mean, here is somebody, so I gave him Briania initially. So for a couple of weeks, initially there seemed to be an improvement, then there was no change. So I was looking at other remedies for acidity, because he kept saying it's coming up, the teeth are, affected. In hyperchlorhydria, I remember in Boric's repertory, I came across Robinia. At that time, I had never given it. But keeping in mind that, so sensitive this person was. So I was not thinking of any other, mineral remedy or something. So with this I just kind of read Boric, and I gave 30. I said, okay, take it in the evening, OD for a week, you take it. And then I started studying the remedy. I was very surprised. So in those days, you should not probably look at the whole family. You were waiting and waiting for the sensation. You take them deeper and deeper and deeper. But to me, if I look back now, if I look as a retrospective, he had said everything that was there to be said. He was in charge of a team. He was managing all of them. They were working very closely together. Suddenly he was asked to leave. He was adrift in life. He was not getting from his relationship what he wanted. His wife was still working full time. He was now doing all the feminine things at home, but he wanted to work. His main thing was that I should start working, I should get a job again, I should earn. And then this acidity comes up. Robinia worked very well for him. I understood why Robinia worked very well for him, because when I read the other symptoms, Yakir, the main thing she says is for acidity, indigestion, heartburn, dyspepsia. So, given this theme and this acidity theme, at a glance, Robinia worked very well for him. But deeper still, Robinia, continued to do very well for him in 200 weekly once doses, because this thing that he had in life that, if I don't work, then what will happen? I'm now doing the feminine aspects of my marriage. So he was kind of not resenting her, but he was not communicating to her. He was keeping everything inside. And this kind of tension in the jaws, tension in the teeth, which he kind of just matter of fact, he would say. But Yakir mentions it specifically. Teeth and jaws are for, you kind of grit your jaw when you have to face a very difficult, when there is an ordeal, you tighten your teeth. Teeth are a sign of aggression. Also, teeth, if you don't masticate properly and if you are eating in a hurried way, leads to a lot of indigestion. So teeth and the mouth and the jaws and the muscles actually perform a very important function when you have to brace yourself for an ordeal, when you have to tackle a difficult situation, you do this, So this kind of tension in this area, the acidity in the stomach, um, teeth also, she says, represent the aggression needed to be in the world. When our infants are born, initially they have no teeth. When you look at them, their faces are round completely, round nose, round mouth, round eyes. The whole, the face is round. They come across as very benign. Infants are very benign. Will you associate aggression with infants? You will never. Because the whole, the placement of the features is also meant to arouse a kind of protective impulse in you. You don't, and then they develop the teeth slowly as they set their foot into the world, and as they start moving, when they become, a little bit active, when they're toddlers, is the appearance of the teeth. Teeth mark aggression. It means an ability to bite into things, to eat more complex substances. You're given things to bite, when you're teething. So this, the acidity, the pain in the teeth and all of that, they were trying to go to the dentist. Next door to me, there is a dentist. They were trying to go and show. And she was saying, nahi, ye erosion hua hai, isko replace karna hai, ye karna hai, wo karna hai, gum recede hua hai. But the beauty of it is we see the whole thing, we understand as an entirety. And everything slowly, as he started getting more communicative with his partner, things slowly and surely, they became very good. As I was saying, when I was reading the remedy again, Yakir very beautifully mentions that if this situation continues, maybe they can go into a state like melilotus. If this kind of grief kind of situation continues, maybe they can enter a state which is maybe like baptisha. They lose sight of themselves. They become adrift, more and more toxic. They can eat fewer and fewer things in life. They're not able to get the flavors of life completely. They can even have the religious affections similar to melilotus. He might even think that she's plotting to kill him or take away his money or whatever, and go into an acute melilotus kind of stage. So I think, the remedy worked very well for them as a family unit. The son's wedding and all was done very well, and he continued to do very well. So once in a while, even now he gets in touch, and he has continued to do really very well on the remedy. So if you look at Fabalis, it is column 5 and row 2. It is infancy. They want certain things. They want to taste life. They want to put things into their mouth. They want to immediately, like infants, they want this enjoyment of the world that they are just able to enter now. But then they're not able to, because there are issues with the other. There's no communication. They maybe sometimes work from a position of mistrust, of insecurity. It can be existential insecurity. We saw like when a very important, crucial family structure goes, like the death of a father, the father leaving suddenly, estrangement within family members is a big theme of column 5 itself, where something happens and there is either a strict father or a father that leaves, but this early row, because it's very, very vulnerable, they're very sensitive to the father suddenly leaving or the sibling, violently being the same. Maybe divorced parents and one sibling is with one parent and one sibling is with another. It can be a very big cause of all these malnourishment, these kind of issues. So it shows up in the GI tract. So this is it. Thank you so much. And thank you, thank you, Dr. Vishpala. I'm going to stop sharing. You're mute. Still mute. No, I can't hear you. I can't hear you, Dr. Vishpala.
Madam, you have to unmute. You're still mute. You
Sorry.
have to unmute yourself.
Yeah. There was some noise here and unmuted, so I forgot. So anyway, it was very well connected, and the theory and the case, because these cases are not very easy to get. Baptisia you may get, but Robinia, very difficult to get. So we are really very grateful, and how you've integrated the theory, explain this with the case. It'll stay in our mind. We feel cases are the ones which stay and which allow you to use the remedy, very often. So thank you very much, Dr. Priya.
Thank
And
you very
I
much.
like the way we all integrate and group, and we are also sharing and learning from each other. It's really wonderful the way the homeopathic world has now become. Nobody is trying to say, this is my thing, this is my thing. Everyone is sharing. So we are very happy with the way it's going. Thank you very much.
Thank you so much. Thank you very much, Dr. Nirupama, and greetings to Dr. Rama. So
Yeah.
and
Thank
I'll see
you.
soon.
Thank you.
Thank you. Bye. See you.
Bye.
Bye. So we've seen how we've done Baptisia and we've done Robinia in case form. And Dr. Priya has also given us some theory about Baptisia. And today our main study is going to be about Baptisia because it's the very important remedy. And I feel we don't use it as much as we should. After going back today, I'm sure we will think about it in fever cases. But I myself can hardly remember any case where somebody said, I can't find my hands or I can't find my feet and my body parts are scattered. Maybe we are not looking at it, but nobody's ever said it. So now we have to look, and that's very toxic. Baptisia is not that it's not been used. Everybody uses it. Whenever you see a very toxic look, and it's as if, more than the fever. Most people come with fever and they look all right. If they didn't tell you that fever, you wouldn't think about it. So in that sense, it's very good. So as we said, as she told you, wild indigo blue color and of the blue pigment, the proving was done by Wallace in 1973. So it is not so very far back. It is within our lifetime. So it is found mainly in eastern USA, but in Kentucky, it was also found that, it's an endangered species. So it becomes even more important. It prefers dry meadow with land, and the spacing of the plant is very important. They have to be 3 to 4 feet apart, and you cannot put it closer because they will not grow. So it just shows how much space they require. And we have to, give it that space. And to reach full size, it takes many years. So it's slow developing. So you can't be tempted to plant closer and get more. And the yellow flowers, indigo horsefly weed. So it is the Fabace with the typhoid miasm. So typhoid miasm, as we have done miasm before, it is there, but it is very typhoid. The whole thing is about hopeful. And the malaria miasm, which was Robina, is it where it is hopeless. It can come and attack anytime. When will I be free of this attack is what you feel as in malaria miasm. So in typhoid, it is that, fever comes down and you can be a little hopeful that you'll get better. So in baptisia, as we saw, there's a lot of confusion, like so many of the confusing remedies, like alumina. The alumina doesn't have so much fever. So there's confusion, there's dullness, there is roaring in the ears, and especially the confusion comes with fever. There's even confusion of identity. So these are very important things that shows you how deep and toxic it's affected the whole system and how very toxic it is. That is, if it is intoxicated, it goes to sleep. And what the difference between arnica and baptisia? We'll come to it again. But baptisia, you wake it up, it'll come answer, but halfway through the answer, it'll go to sleep. Arnica will complete the answer and then go back to sleep. Lot of fears, as in all the whole column. Fear of the bed, fear of dark. The little girl, she prays to God, saying that, let me have a peaceful sleep and not feel suffocation or choking, or that somebody will come or poison me. That's how children have these fears. The ghost will come, take me away. You can see the bird, you can see big limbs waiting to take her away from the bed and separate her from the family, which is the most important thing in this whole family, is that you will be separated from your family. So dreams are always about quarrels and strife and imaginary. And the body parts are being stabbed. That's how they are taken away. A lot of loquacity, because whenever we are very anxious and very tense, we try to overcompensate by talking. It may be called verbal diarrhea. We'll see that in other remedies also. Very acute stage, very thirsty, and very stuporous. So you have dull, chilly, and very thirsty. And they're much better in open air. Will also have spleen problem, because any toxic thing, the liver and the spleen, which are the drainage parts of your body, will get affected, especially the spleen. So here there was a patient with throat pain. She's already given you a beautiful case. We'll have some more cases with throat pain, and she can only take liquids. She cannot do solids. Okay. So it's opposite of lac acid, which can do more solids. Can't swallow anything except liquids. The typhoid is a fever. Went to many doctors, want to get relief so she can live and not die. So there's this fear of being died, because dying also takes you away from your family. After baptisia, she put on weight and she was doing well. And so we can use it even as the constitutional later on in the same remedy. So it is like gelsemium in the acute stage, also toxic, but baptisia is very thirsty, whereas gelsemium is very thirstless. Stupor, drowsiness, delirious, gelsemium never asks for water, always dry. And this is dull, chilly, and thirsty. Sudden manifestation goes into dull, drowsy state. Sunken state very fast. Gelsemium is slowly goes into it. This goes very fast. Therefore, it's a very acute, very toxic state. So sepsis, foul diarrhea, the whole house smells. So the mother will tell you that if the child goes to the bathroom, we can't enter the bathroom after that, and it comes out also in his whole room. So you have a very strong odor. You have a dullness, you have thirstiness, and you have besotted and very drowsy. So you have pain in the head or sore throat or whatever, but profound prostration. It is even more than arsenic. We know arsenic and phosphoric acid are so very prostrated, but this is even more so. And with the drowsiness and the dullness and the toxicity, which you have to remember. Arsenic is anxious, but here it is delirious, very toxic. drowsy, scattered state, congestion with stupor. And in spite of all that, it is painless like opium. Therefore, opium comes often for comparison. Red face with high fever leading to this drowsy state. Very loquacious, forgets difficulties. And most important, in the background, you will see some form of family breakup, whether it is the parents' divorce or her husband's divorce, like we saw here, or it is that one brother is going to leave and stay in a separate house and he was very attached to the brother. So the family is scattering. So you have to always think of this family, this whole group of remedies when you're thinking of family breaking up. You will say it's happening every day. Yes, but people go about it slowly, congenially, understand the problem of shortage of space or something, and we are going to be close by and meeting and still having food together. You don't feel it so much. And whereas if you have strife and quarrels and everybody wanting their, share, then it becomes very ugly, and that kind of a separation really affects the Fabian's family. Restlessness with weakness, inability to take any action, exhaustion, and blues. Not only the flower giving that blue pigment, but past blues, all that remembers all about the sad part of before. That when memory, there are some remedies which think only about the pleasant part of past. Some remedies think of the brooding and the ugly thing. So it, as we said, it can even travel to Alzheimer's. Suppressed by the husband, we've seen masculine, because this is the remedy where they split. The whole column is split between the male, masculine and feminine. And when the masculine is trying to take over, the feminine is trying to go away. So it will be about the domination of masculine. And they don't want to split. So sometimes they are suppressed by the husband. They decide to separate and still live in the same house. So they adjust and stay, though they have no desire to live in that house. So there is abuse of some sort, whether it's sexual abuse or other abuses, but they don't feel the pain. You remember we did Rosa Bracata, the remedy which you will not yet managed to even find, but that has a lot of sexual abuse and it's used in Italy a lot for sexual abuse. But here it is painless. They don't feel the pain. They understand there is a problem, but they are not acutely feeling the pain. So they don't want to disconnect. Answers, as I told you, half answer and go back to sleep. You can even travel to schizophrenia if the problems are not sorted out. The parts are scattered, divided to 3 parts, lacking the ability to connect the different opposing parts and to stay centered. So you have, the 3 here and the 4th one is gone. That is what the picture is trying to show. It becomes very violent, and the feeling is of the split feeling in the family, in the parts. So, I have many people who say, oh, they've been separated for 20 years. I know one family really, but they all stay together. So you can imagine the strife, how difficult it is to separate. In Bombay, of course, it may be just that cannot afford another place, but also it can be that the wife cannot live alone and wants to stay in the same house. So very important remedy for women, and where they don't even recover post-delivery. And the post-delivery period is very prolonged. Pathology after miscarriage is very violent. When you have miscarriage, yes, you'll go through grief and you'll go through so many problems. But when it's very violent and very toxic, you must think, with fever and delirium, you must think of baptisia. And where in the past there were grave and post effects after thing. Also severe effects of any acute disease. I remember a case once, not in my time, I was a very young girl, and Dr. Maganwai had a case where the girl had typhoid and she was very beautiful. and beautiful hair, and she had to wash it and keep it very well. Imagine, I'm talking about, 50, 60 years ago. And she had severe hair fall and severe depression after typhoid, mainly due to the hair. And she was anyway for a fever baptistelle. So in the final stage, they go into depression and then ignore everything, because there's no way to live with a split family, but to finally accept it or just this thing. But they want to still be bound to the family. And if that is not happening, then they despair whether they can ever recover. So the classic picture is associated with congestion and accompanied by dryness, and therefore it's very, very thirsty. Dryness in the mucous membranes of the mouth and the upper respiratory tract, the head, especially in fever situations of flu, where the patient is dull, hot, thirsty, or maybe chilly. So the toxic situation where there is a sewage-like atmosphere. So whether it is just the odor from the discharges or the bowels or whatever in the bathroom and spreads to the house, or the whole atmosphere in the house is like sewage, it's like very bad. The parents cannot be together at all without creating so much friction. The father tells, I'm leaving the family. Or she says, I never knew my father because he left very, very early. So either the father can be toxic or the mother can be toxic. I'm watching particularly one serial these days, which is called Orange County. In that, the girl was like a princess, always very good in school, very beautiful, very good in school, even in social work, in class, she did very well. And she was like the epitome of, grace and stuff in the school. She used to enjoy a lot with her father, and she would go with her sister to play with the horse. That was the evening pastime. Sister was younger, but liked ponies. So she had a pony. She would go and ride in that. And so it was very nice. And her dream was go to college and, do very well. And then there was a problem. The father lost all his money. And the mother became really toxic. And then the father left, and she was actually very attached to the father. So she began to hate her mother. The mother started having multiple affairs, and the sister was very young, so she was all the time kept at the granny's. But the sister later on turns out to be a little bit like the mother. But this girl then goes into a sadness, and she completely loses herself because she doesn't recover from it. So yeah. So I was actually not thinking of Bhakti. I was thinking for a Rosa G, because she continues to help people and lay out herself for a friend who's ill or something or the other. So I was thinking of Rosa G for her, which they say is like Florence Nightingale. Anyway, not that I am ever going to have a chance to give it as just a serial, but when you see serials and if you connect, the various people with remedies, it helps you understand, and even to explain when you're teaching, or it can help. So all life they spend trying to pick up the scattered parts which are bad. Yeah. So congestion is often associated with these toxic conditions like fever, food poisoning, sepsis, flu, foul-smelling diarrhea, which permeates all throughout, besotted countenance, bleary eyes, intolerable sick people, says Allen, and profound prostration, says Clark. So the remedy is there from many years. Like the Ross proving was done in 1973, but I somehow feel that, the remedy was used even before. The mind is not mature. You are at a stage where the feminine is going down, masculine is coming up, and you have to become, and it is right in the top, the womb and the next stage. So it is womb, and as Priya explained very well, yeah, not able to cope because you're still in the 0 to 1 age, and you are very, very vulnerable. So the fever characteristic, quick fever, quick children with secretion from eyes, nose, stinky, smelly diarrhea. With high fever, they get dull and apathetic. There are so many children who come, mothers who come to you saying, fever, we never know, he plays around with fever. Or when the fever becomes very high, he lies down for that hour. As soon as the fever goes down, he is out. So this is certainly not baptisia. Yeah. So when something threatens their life, they kind of just disintegrate. So each problem is associated with the same stage, whether it will be a year, like this baby has here, and each one, the main characteristic, what we have to remember is drowsy, scattered, congestion, stupor, painlessness, profound prostration, heavy drowsy state, loquacious, forgetting, difficulty in concentration, floating, and feels divided and scattered and all over the place. So baptisia often is there picking clothes, just like Alzheimer's and the trio of the fever remedies. Emotionally, they cannot endure the family to break up and scatter. The remedies indicated in children whose family or adults whose families were dispersed. Child is sick since the parents got divorced and the family fell apart. So Grand George says lot of remedy, the remedy is very useful in children were of divorced parents. And when they become emotionally remote. So, in the old days when parents kept their fights in their bedroom or in time when children went to sleep and not in front of the children, which really traumatizes. So today, I think we should all have some lessons to become good parents. Whatever is your problem, keep it to yourself and don't keep it, in the whole outside and affect little children who are not capable of dealing with it. So even just saying that, oh, we travel separately all the time, is a show that they are not together. So the basic security is impaired when the parents, so the row is about security, right? Womb, and this is always about security. Then they grow up well. And when the parents, the fifth column, split and scatter. So it is a syphilitic remedy, baptisia, that responds in disintegration to threat of the family falling apart. And this R. Levy says that this is confirmed by many cases. In extreme case, there's a sense of duality leading to loss of identity, feels detached from the body and tries to reunite with it. So one patient said, I was really happy when I got the disease because it helped me to reconnect with the body. So with the split and separation, that because now that me is coming up, so somebody other, I have to recognize somebody there's other than me. So till that womb stage and the oral, so we feel me are the whole world. Now we have to recognize the other. The location of the row at the instigation of the life experience, baptisia are not able to make the distinction between me and the other, and losing himself when encountering a force stronger than himself. The masculine potency necessary for actualizing the separation not ready yet, a lack that is stemming symbolically from the lack of the father. As I told you, there is the serial. They have difficulty on separating from their families, have difficulty leaving home, although they know that they will have to do so. So Vitulka says that baptisia gives a quality of death and decomposition. The system deconstructs and each part returns to that initial place of the first. They are disconnected individual, not whole, not trusting, not all together. They are disconnected. where arms are separated from the body, or like she said, I'm looking for my hands, leave their body, breaking down during sickness, especially fever. In extreme cases, this can go on, this kind of a mental state, if it goes on and not remedied, can lead to schizophrenia. So he said there is severe and deep depression. What are the blues? So the blues, there are lots of songs on them and lots of talk about the blues, but normally it is Sunday blues or something, and Monday blues, and then it's fine on Tuesday, yeah? But here the blues stay. So Alzheimer's accompanied by depression, Alzheimer's in women who have been suppressed by their husband and could never express their feelings. So you think that it will be there, you can suppress, but it will sometime erupt. And if it doesn't erupt, it will come into form of some mental disease. No desire to go on living. People who were sexually abused and as a result became numb. They just want to sleep and not feel. So when you sleep, you don't feel, you're just away from the whole world. So do not want to feel any pain. So they repress their feelings. I don't want to fight. I don't want things to come to a head. I don't want to know things. So I'd rather sleep or suppress my feelings. The answer, stupor, returns after answering, answers the question and returns to coma. Coma is the best part for them. Or it can become violent, succumbing to the split, becomes schizophrenic. I like this picture especially. If you can imagine that you are a monkey, or imagine that you are completely ruined. Divide into three, lacks the ability to connect the different opposing parts and to stay connected. So there's passiveness in accepting life, hence the tendency to miscarriage, because they don't know that if things have gone wrong with us, it can go wrong with the child, and maybe we don't want, maybe this is okay at this level and it can end with me. So then there's miscarriage. There is no tonus, and the miscarriage is due to looseness of muscle. There's no built-in resilience. In the beginning of the column of the fifth subclass, the fifth column, there is no resilience. They cannot hold themselves or bring themselves together again. So the core of baptisia, delusion, bed off, scattered about, can't get the parts together, we don't know, and the blue, yeah, depletion of the blue. So the tendency for laziness is now understandable, because he just wants to get away from it all. I don't do anything, so I am not stressed or tense about it. Neglect, curls up, and just lies down. So that's all. So doesn't want to do anything in the world. It is the inability to unite the opposite poles of masculine, feminine with primal insecurity, detachment, and dispersal, throwing here and there. In the morning, when you're required to start the day, you will get up fresh, happy, active. What am I going to do today? But here become discouraged, retreating into a state of insensibility through dissolution. Frequent spells of unconsciousness all over the place. You can't see, all over the place. That is what Priya also quoted. That's a nice word, nice way to explain that you're just not there together. This is the effect of the row. In addition, there's anxiety about health, despair of recovery. It is syphilitic miasm. Anxiety when talking, thinking of their disease or pains. Do not want to think about things that are falling apart in their lives. They don't want to think, they want to be unconscious, something like opium. So a case, another case, a woman born in 1970, single, patient one before baptisia was even proved, as they say. I don't believe it. Patient won't allow picture to be taken of students in the room, She doesn't want that wholeness or anybody interfering. She goes for psychotherapy regularly. Life is not regular, but the problem is the bad mood. She does not enjoy life, does not know how to manage mood. I feel no joy. I feel blocked. I feel detached. I feel it deep, deep, deep in my abdomen. Impatient, but this is the row, 0 to 1. I want everything here and now. Yeah, this is the row. When does not happen, she feels insecure. When you return from work, there is no energy. So at 5 o'clock or 6 o'clock, when she comes back home, she has no energy. Though it is very monotonous work, it makes her stressed out, her work. Her dream is she lives in this damaged houses. She lives on the top floor, but she has no access to the rest of the house. And strangers live in the house. How is that possible? She said. I'm so confused. So it is another part of where family has also become strangers and she has no connect with them. Very good picture. She's flooded, another dream, flooded by water. Recently driving by the sea and there was a blue glow and she almost flew off the road and she was afraid to be inundated with the water. This blue glow is unknown, so wild, so endless. What if I'll be flooded completely? Would I disappear? So the feminine quality, which is becoming less and less, now becomes threatening. Would I disappear? Worried if it is due to anxiety about uterus problem. It's female things. So uterus, female, disappear, tumors, other problems of uterus. When sick, she only wants to sleep but wants a family nearby. She doesn't want the family to go away when she is sick. She's always scared of. She's afraid to show who she is because she suppressed. She wants to keep everything inside her so that she doesn't disturb the family. Afraid to be criticized, not be understood, to disappear, not be a part of, or to be shoved, thrown out, and lose contact. She's also afraid that she will not change, that she won't be able to develop all her abilities and her life would not be fulfilled because the quest of column 4 is to have the masculine, have a work, have a role, or start a business, whatever. So I will, accomplish something. So then she said she won't be able to develop her abilities, her life would not be fulfilled. And again, I will get sick and again, I will have uterine tumors, syphilitic myas, okay? Also like malaria. In the past, I was working an uninteresting job, but when I got the cancer, I was happy because it reconnected me with the body. I knew where the cancer was. I knew where the pain was, so it reconnected me with my body. Today I feel stuck, as if I'm standing in front of a wall, cut off from the stream, incomplete, as if part of me is here and the other part not here and I can't touch it. So I have only some part, and if I'm not a fully part, I cannot evolve and grow and fulfill all my ability. Does not know how to manage mood. So here the analysis was job, career, and split and lost and parts missing, Rosidea. Impatient and drowsy because of the cancer. Again, I will get sick. Again, I will have uterine tumor. Again, the job will aggravate. So it is scattered in addition to all the other things. So, and grave lethal pathology. Can you see this? Though it's in yellow, I did a quick working on this thing. I took scattered in the same remedy as dispersed, in the same remedy as confused, in the same remedy as painless, same remedy as sadness, drowsiness, fear within 3 words of disease, in the same remedy as stuck, as connect within 3 words of body. I can connect to the body. And you had only these few remedies. Anacardium, arnica, baptisia was the biggest. Kali-Kav, lachesis, opium. So we see how opium, which is all the time related, or arnica, which we all the time do DD, comes into play. And it was nice to see that, yes, even from our repertory, even from reference work or whatever you use, you can come close to the remedy. So with Baptisia 200, these feelings of sadness, depression went away. Her cycle became regular and she started to feel her sexuality, which was gone suppressed. No? More relaxed and confident, which she had lost completely. The wall blocking her abilities was gone. She was able to enjoy and look forward to the challenges. And she dreams of cleansing and bathing, which means that the things are going out. The toxicity is going out. Yes. So it is grave, even other remedies, prostration, Crohn's disease, all these. And of course, another remedies compared, which we have yet done. So offensive, pathological, and whenever resting, sharp pains. So anxiety is like arsenic. My arms are double and like an anacardium reality. Arnica answers, goes back to sleep. Baptisia answers, halfway goes back to sleep. Tongue is peculiar white, red papillon. And pathology, stupor. Anything, the typhoid gives stupor and drowsiness. Grave, very grave. And in the background, you have the split. So in many Indian movies, we see the split family and brought together. So legumes, hum saath saath hai. Clumsy, sense of duality, arnica and baptisia and typhoid. Arnica and acute injuries, bed is hard, drowsy. Okay, so that was baptisia. I think we can use it much more once we know the full extent of this remedy. We have done 3 cases. Priya has done a beautiful case of where there was also toxicity, where the husband was going to leave and father had died. And that severe toxic situation, and when she couldn't find her hands. Can you help me find my hands? And first you'll feel you haven't heard right. What is she saying? We've never heard this. Yeah. So, and then we can compare it to other remedies in the same family and with other families like arnica, which is composite family, and opium, which is the opium family. So that was a big remedy we did, baptisia. We've taken the maximum time over this remedy because it's going to be the most useful for us in case we have not been using it so much. Then you have chrysanthemum. This is like aroroba powder. It is yellowish brown powder, but the tree is beautiful. All of them are beautiful flowers, pink flowers. So here it was seen in Portuguese community in Goa, and therefore it's called Goa powder. It's added to chloroform 50%, and so it is a powerful irritant of the skin, and everything becomes very red. Psoriasis or ringworm or even urticaria, very red. Violent itching, vesicular lesions, crust, and scalp eczema. You remember Mesothelium, we said all the features, but scalp eczema or tinea capitis. And this is the ringworm miasm. Baptisia was the syphilitic miasm. Robinia was the malaria miasm. Foul discharges like in the other family members. Small eruptions come together, become very foul and sticky. There were diarrhea and gas. Here it is skin eruption. So eruptions behind the ears, like you have in graphitis, petrol. No blepharitis, violent itching. You may even have HIV, herpes simplex, all the things which have some skin problem. AIDS with skin complaint. Pityriasis vesiculatus, herpes and eczema, ringworm, violent itching behind the ears, filthy scabby condition from thick crust. So herpes simplex or skin complaints in AIDS or in any complaint, psoriasis, scabs, whatever, ringworm. So that is the most important thing. We don't even have a case. But if you have the Fabaceae, you have the Fabian's cup thing, and you have the miasm, which is ringworm miasm, which keeps coming, it never goes. What is ringworm miasm? Never quite goes away. So you do things, and try to solve it. Then you rest a bit. And you say, no, let me try again. So it will be all skin troubles, obesity, acne, things which never really go away. So chrysanthemum, we have to use with the generals of the Fabaceae family, and the miasm, which is ringworm miasm. And what is affected most is skin. So you can remember the behind the ears and crusty, offensive discharge. Then you have another remedy called Citalpenia bardosella. So it is a drug from both India and Persia. It is there in Bengal, in South India, Bombay. And Hindus and Arabs use it for leprosy. So we must know this remedy because we don't have so many remedies for leprosy. The most work I know which was done on leprosy is tuberculoid leprosy by Dr. Dixit. There is to always say, give a syphilitic remedy first, hepar mercury, to take away the first layer, then go to it. And I had a patient in Palghar for the longest time, and we got him completely out of it till he's now left with only not being able to do the smaller buttons, when he can't put, or the smaller things he can't pick up, smaller coins, very small coins he can't pick up, but he's come a long way. So leprosy is a condition which we don't treat so much, or we don't have so much experience with, or we are scared to do it. So remember this remedy, which belongs to the fifth subclass. It had all the features of the fifth subclass, and it is called Citalpenia bardosella. So leprosy miasm, as we know, it is isolated, right? Leprosy, left out, thrown out, this cast off, never thing. We have to only remember Ben-Hur and how the mother and sister were put in a far island, and they could never see them again. And the old leprosy, you had like that, you have claws, or you had nose falling off, ears falling off. So you can be useful for asthma, leprosy. Tremendous weakness, we saw that in baptisia. You will go in the whole family. Acid-like state, no desire to talk, and extreme weakness, whether it is fever or other. Moving, of course, is not done completely, but there is mental depression. There's craving for boiled rice. Thirst is only in the morning and then no thirst. So gurgling in the stool with sticky stools, and the stool will be again offense. And you have splenomegaly, which is again with the whole family, because wherever there's serious things to be thrown out of the body, toxins to be removed, then those organs will be affected. The spleen, the liver. Saffron colored stools. We've never seen it. Anybody sees it, please think of the remedy and share with us. Yeah. Tongue, slight coating, and useful in leprosy, TB, and asthma. So leprosy with fever. Fever is from 2 to 4 or 8 a.m. to 8. Terrible pain in the eyes before fever, better by cold. Fever is changeable. Eyes pain before fever. Fever is irregular with chilliness and shivering. And stage of heat and fever is last maybe 6 hours or so. Then sweat brings out. But after fever, there is severe weakness, and whatever discharges are there are terrible. So desired boiled rice. There in the liver region and the spleen region, there is uneasiness and liver enlargement. Nose, hot breath during fever. Very fast respiration. Skin is dirty black. Spleen enlarged and hard. Two saffron colored. No liquid, severe pain in the temple. Skin is blackish. So that's all we know about the remedy. What is the remedy called? Cisalpina bardosella. It is useful for leprosy. And the earlier remedy which we did was chrysanthemum, which is useful for skin condition with the family fabians. So there are few, it is small remedies, but just because of this characteristic itching, dry crust, all merging, one eruption and the other all merging and become terribly hard, and the crust form and very smelly with violent itching, and it looks so dirty you don't want to touch it at all, with foul discharge. So especially behind the ears, and with lot of severe illnesses with skin, you can think of chrysanthemum. And very powerful irritant. Itching is 3 marks like Mesarium, and very, very, very red. And then you have Cisalpina bardosella, which is mainly for leprosy and asthma, and there's extreme weakness. So you have to remember these, just what is it for? It is that family, you find some split, some problems with the splitting, either the parents or the brother, sister, the husband, wife, the child, mother. And you have a special disease like leprosy and Cisalpina. You have skin and thick crust in the other remedies, and you have fever in baptisia. So if you can remember, you have to have the generals and you have to have these specific, then you can use these remedies. So here you have this very peculiar saffron colored stool. We have to see whether we'll ever get it, and craving for boiled rice. So fever with a lot of weakness following that, with eye pain before the fever. So likes that, likes boiled rice, you have hepatic, your spleen, which is enlarged and hard. Then you have Glycyrrhizia glabra. Now Glycyrrhizia glabra is like that yash madhu, madhulika. So this is a good remedy. It is a licorice and liquid, yeah. And again, a beautiful plant with bunch of purple flowers. The roots are used for preparation of the licorice, contains glycyrrhizin, which is similar to cortisone. So it raises the blood pressure levels and calms the cough. Let's see what the cough is like. In Chinese medicine, the plant is considered soothing, used for cleaning the digestive system, reducing gases, increasing activity, the gallbladder, and absorption of food. So where we have, some of our organs which help, either in discharging, like you have the spleen and the liver in this, the earlier remedy, Bardolika, and you have Glycyrrhizia glabra, and here it is used for cleaning the digestive system, lot of gases. It helps the gallbladder to become more active, and therefore it helps to absorb and digest the food. The remedy expresses weakness, lack of readiness of the masculine aspect. So you have weakness after emission, he goes to sleep, doesn't get up the next day, or no sexual desire, swelling and itching of the male genitalia. So now the effects, maybe you saw in the earlier remedy, uterus was affected, and saying, my uterus will be affected again and again. And here you have the male genitalia. So either you have menses suppressed and miscarriage because you're not ready to take on that responsibility, or you're too passive or too weak to take on. So you have miscarriage, and you have all here, you have sexual desire not there. Again, it can be lack of desire for a infant, baby. Then you have insomnia, excessive perspiration of the palms. You always think of silicea when you have this. Severe acne symptoms like a hormonal imbalance. We did a case last time of Copaiva. Dr. Rushali shared a lovely case of Copaiva with us. So yes, so the things to remember are the themes. If we remember the themes and we can come to that, then from the family we can select the remedy, because each remedy we will not know and come to it. Okay. So Lysarhiza glabra has severe weakness, like the whole family, lack of vital heat, emaciation, emptiness in the stomach. So when hungry, it gets vertigo. Nothing new about that, right? When you're hungry and weak, you may get chakkar. And fear of falling, forgetful, concentration difficult, dullness, sluggish. And the brain is congested, frightened easily. So a lot of these things are common to the whole family. The weakness is common, the forgetfulness is common, concentration difficulty is common, even baptisia, dullness, sluggishness is common. So we have to remember what is special about this remedy. So here it gets more vertigo. So we said it is common, but in Glycyrrhiza glabra, we have vertigo much. In the others, we may have pain much. And very, very important here is congestion is expressed to loquacity. Obsessive thoughts is called verbal diarrhea. And physically, you have congestion relief through epistaxis. Yeah. Bright red blood, especially when you have high blood pressure. So strong skin sensitivity, we saw it in the other remedies also. But always itching here is sun exposed areas. So sun. So we'll see we saw one case of solanum where the skin kept coming when exposed to the sun, and the remedy was made from the sun, solanum. So this is very important remedy for mulethi. We have in India mulethi, which we eat for as an expectorant in cough. And so from that we can have the generals at the back, where like lack of sexual drive, where there's weakness, fear of falling, concentration difficulty, dullness. Weakness after emission and either lack of sexual desire or lies down for the whole day. The patient will come and tell us, we had some sex last night and after that the whole next day I could not get up. Okay, so for a natural act, there is a lot of weakness. And then it is useful in high cholesterol, intestinal infection, IBS. So here you have a lot of stomach. We saw in the previous remedy where it is the skin, in the previous to previous remedy, different. So if you can remember the family and we can remember which is specific, bacteria, your fever and so on. So here in Glycyrrhiza glabra, we have sex, chocolate desires, obese, intestine, obstructions, IBS, colitis, all in the stomach. It may look like the calcarea patient, but it has more different things, and yeah, a lot of stomach. Calcarea are not only restricted to the stomach. So case, a young woman complains of depression, digestive and various stress pains, skin and allergy problems. She talks and talks. So the congestion has to be relieved in various ways, through breathing from the nose, in the same thing, or talks and talk like verbal diarrhea. I left my family, she says. I feel lost. I want support. She feels hormonally imbalanced, depressed, stressed, anxious, down, and tired. So what was her story? She said, every day it gets more and more difficult to function. I just can't function. Young girl, such a sad face, can't function, foggy, no concentration. I'd like to keep busy, but work is also source of stress. But a lot of people need you, they ask questions, they want a lot of interaction, they want solution. So it's all very difficult. And in night, those little things which keep me awake, going over and over those small things and torturing myself, and torturing dialogues with my ego. Did I do right coming here, listening to my husband and so on? So she and her husband have just immigrated to another. Her husband's family was rich and wanted them close by, demanding her to conform to their lifestyle. So, yeah. So, wherever there is, I take a lot from serials that I watch. So there was another serial which I was very fond of. And in that, there were many children, and each one had different problems. But here she fell in love, the youngest girl, she fell in love with a man who was actually a cook, and they set up their own bed and breakfast. But his family was very rich and wanted them to the wedding in their own style, in their own place. But her husband agreed with her, and they stayed in this simple lifestyle. And it's called Chesapeake Shores. The serial is called Chesapeake Shores. And they did well by not associating with that very rich family, because then the father was jailed, or at least was going to be caught for some fraud, and he ran away and so on. Whereas their lifestyle was much more simple and down to earth. So this girl, but she had to go with her husband to this next country, and she felt she didn't fit in. And she was balancing two lives. Every day it gets more difficult to function. I like to keep myself busy, but these little things keep on and on. My family and friends are at home, but my life is here. I have no support here. And again, she cries. There. So see, here and there. There you're integrated in society. Here you're on your own. Your friends and lives don't connect. Each one is going their own way. Nothing fits. Yeah, the plug doesn't fit into this socket. I spend a lot of time alone because my husband works late. My family is far away. I have no social life, no friends. My husband cannot be all my family and my friends. I worry about my family in that place. We are in contact a lot. Now I fall sick very often with fever, with cold, with blocking. I feel sad and depressed and don't know what to do. I miss the bliss of having a day without sadness. So she's sad all the time. She wants just one day. See how our dreams can come down to such mundane things. One day without sadness. She problem began when she married this man from another country, moved there. She could not adjust, missed her support system. She was split between two countries, between two families. Yeah. So the split. She's very talkative with endless examples. She suffers from indigestion and maintains a strict diet. So these are the fabulous themes. Yeah. The split, the beginning of the fifth column. So with the remedy, Glycyrrhizia glabra, she was crying less, her digestion improved, her skin improved, and somehow she found a solution. Stay a few months in their home country, few months in the other, and finding peace in that split state. So there's always a solution to every problem, but you have to find that solution. You have to be ready and have the strength to find that solution. But if you are already so debilitated and so weak, which is the fabulous theme, then you can't find it. All you do is keep thinking and thinking of it, where you have no solution. So yeah, so you have a problem which is very common in practice, which is that I don't get sleep. So what do? It said, she's saying, I get sleep only alternate night, which is very good actually. At least alternate night you get sleep instead of having insomnia always. And she said, all night. So what are you stressed about? No, I have no stress. All I'm thinking about is, why am I not getting sleep? Why am I not getting sleep? Why am I not getting sleep? So today I told her that, in Vipassana, when I went for Vipassana, we were not getting sleep because it was a new place, new experience and all that. But they told us very clearly that actually you don't need sleep. Your head and your mind runs anyway 24 hours. So what requires rest is your body. So even if you lie down for 7 hours, your body will get the rest. But it is the thinking, I'm not sleeping and therefore I'll be tired, which makes you tired. So just relax, sleep, think, meditate all the time or breathe in and out and let time go and don't think about the sleep and you will get up fresh. So this is what I told her that she must do. I don't know if she will. I know it helped me a lot and I do this even today if I don't get sleep sometime. I lie down and think and I don't worry about why I won't get sleep. Like last night I got sleep very late for no reason. And I was thinking, oh, I should sleep because tomorrow I have this big CME where I have to talk and talk and talk and talk. Yeah, so I should sleep. I did get less sleep, but I was fine because I followed this theory. So here you had ovarian pain with this congestive headache. Headache was related to the hormonal source and hormonal problems, amenorrhea, irregular, profuse, prolonged, painful, all these things, and desire for sweets, coated tongue, white or brown, like antimtart and so many remedies, arsenic. Arsenic, they say the tongue is as if painted white. So these are probably indications of candida. So that was the remedy, and she did quite well with Glycyrrhizia glabra. So what are the remedies we have done quickly today? So this was the girl who went to another country and couldn't adjust. And then what was the solution finally? Live some month there and some month there. I don't know what happened to the business, or maybe it was business which you could do from anywhere. So that was good. That was the solution. And she took Glycyrrhizia glabra with her stomach things and she was much better. Then we had the leprosy miasm in the Cisalpina bardoncella, and like they had craving for boiled rice, and the splenomegaly, which was enlarged hard stool, and here the sticky stool, there it was pain in the abdomen. So here it is more leprosy related, and that was more stomach related. In Cisalpina bardoncella, you have the leprosy and the TB and the asthma with extreme weakness. So you have chrysanthemum, which has more skin. Although they join up, they form crust, and they have horrible smell. So whether it is psoriasis or whether it's eczema or whether it's ringworm or just herpes simplex, AIDS, but with skin problem, with tremendously violent itching and foul discharges. So that is chrysanthemum. And then you had, of course, the big remedy which we did, which was baptisia, where there is the split, where there is hands you can't find. Please help me find my hands, said the wife. And the bed is hard, and she's constantly trying to find a soft place where to sleep. This is what we learned in college. But we knew it was toxic, but we didn't know it had the Fabils theme or split and separation and all that. Yes. And we had this wonderful case of baptisia and robina from Dr. Priya. Robina is where it is the malaria miasm. Yes. So, yeah. Malaria miasm is where things can happen anytime. You're just not safe. Never know when it's going to attack. Typhoid is where you are hopeful. Syphilitic, where you're hopeless. Leprosy, where you're completely outcast and thrown out. So we've done a lot of the remedies, and we are going to do a few more remedies next time from the fabians, and then we will be through with the fabians, right? So we would have then done which all families. We would have done many families, right? So we would have done the Rosales, and today I told you the Rosa G of a case also from a serial, and Night Tales, and we are going to complete the Fabian next time. Okay, so we have done 14, 15 remedies, Rosale, My Tales, but Fabians we are going to do some 18 remedies. I told you that the biggest family, it was 45. We are not going to do all 45. But if we know these things, then we will be fine. So, any questions? Next time we will do physostomy.
Yeah. One question, Dr. Vishpala.
Yeah.
In a nutshell, how would one use Glycyrrhiza glabra?
So, in a nutshell, the glycyrrhiza.
Traditionally it is a licorice plant which we use for expectoration, gargling, etc.
Yeah. So that is what. So it is mainly to be used in a lot of stomach problem. And I had always thought that it should be used as a tincture only and not as a, a remedy in potency. And it has too much weakness. It's mainly focused on the stomach. And it has vertigo. When you're hungry, you may feel weak, but you don't have vertigo. You may feel stomach pain and you may feel like lying down. But this has congestion with severe weakness. And when you're hungry, doesn't mean you always feel weak. So you have to get the family, the family, whatever are the themes which have to come in. And everything, fear, this thing. And then the discharges. They said here it is verbal diarrhea. And you have also bleeding from the nose. Anything to come out, discharge the congestion. So you have sun-exposed areas like solanum here. And you have tremendous weakness. Imagine after sexual drive, the patient telling you, I don't get up for the next day, I don't go to work. So it is completely out of proportion. Whenever we say pulse out of proportion like pyrogen, we have something or the other which is characteristic. And we should put this down in our one-liners so that we can, use them much more. So here we've seen one which stomach, one we have seen which is on leprosy, one which we've seen is only the skin, and one which is the fever. So quite good that we have these separate things. Yeah.
Thank you. So this where he's holding the, I have a patient, why I'm asking you is because a patient with a similar kind of weakness, he has not recovered since flu, and there's a lot of digestion issues, gas, etc. And he says left-sided pain. Here the picture was more the right-sided pain because of the, is it because of the gallbladder? We don't know.
Here you have both. So the gallbladder is there, you have the spleen also. So you have
Right.
the side. So here there is no particular side which has been mentioned.
Okay. So this talkativeness is a big thing. This verbal diarrhea is.
Yes. Talkativeness is verbal diarrhea is very distinct. And and lot of indigestion. So we have to differentiate from triticum. You remember we did the monocots and where there's a lot of all those food things which have lot of
no, and he has this thing. I mean, he has come from another country. He's moved. So the digestion issues have become very pronounced. So he's on an absolute bland diet.
Yeah. So that is the split. That is the main split where you cannot adjust. And she found out the adjustment by living here and living there half the time. So you find some solution. But here it is much more severe than your monocot thing.
Right.
And you just cannot seem to be getting rid of it.
Thank you. Thank you, ma'am.
Any other questions? So it was a good session. We've done a lot of cases, and cases are always very good because we'll remember Copaiba. That's why today I decided to do a reference work column for you with that remedy, where you can say that I can find the remedy Baptisia even without, of course, fever will have to be there, but even if it's not so toxic, or I think it is not so toxic, but I'll find so many things. And in the repertory or reference work, so whatever we referred will help us. Yeah. Thank you so much.
So weakness is a characteristic of Fabels.
Yeah. Weak,
Okay.
and that also out of proportion.
Proportion, out of proportion in all the Fabels.
And all the families, and weakness is tremendous, which is there, and the split, of course, is we cannot.
Oh,
ever-
Therefore, the comparison with the acids and gelsimine.
so acids come up, but then that will be the mineral kingdom. So
Right.
here you have sensitivity to the split, whichever split happens in whatever form, but how it affects you is what we have to look at, right?
Right. Thank you, ma'am.
So thank you all. Next time we'll finish Fabes, and as you saw, we have just done womb and the oral stage. We have a long way to go to finish the whole column, right? Okay. Thank
How are you doing today? How are you doing today?
Much better. Thank you.
Super. Great.
So, yeah. The doctors have also
Ma'am,
said good. Yeah.
One thing, like last two Rosals and Michael, you have given us the one-liner. Would you able to give in this one-liner whenever you have time?
No, let me see what we have done. Why not try? Because I keep adding to the one-liners. So let me see what we have.
I know it's too tedious to do that, but it's good for the listener. That's the only thing.
So there's one, I'm trying to get this one remedy, Prunus americana. See, we've done California like carcinosin. We have given Ros canina to somebody. Rosa D, we have given to 2-3 people. And we are finding a lot of good results where you have this eco, where I am always right, and still so much anxiety and so much bothered about how they look and all that. So Rosa D, we have found useful in 2-3 cases, something which you never have known earlier. And so this is all about best and beautiful and very egoistic. So yeah, so we have 2-3 cases for that. Gallica, I told you about, where they are Florence Nightingale. Prunus spinosa, we have seen with that headache, nothing helps. And cotyledon, we've seen choking and tingling and alternate depression. Babies cry and cry and cry. And the peculiar was left nipple to the umbilicus. The hydrangea was where we saw the yellow sand in the urine. Then we saw angophora, which is like, eucalyptus, brittle nails gone. And yeah. And then we saw kufia, which was, it has tannin, so it gives you a lot of energy after cholera or after any disease, and worse from sour and milk. So that is Kufia. Kaju Putnam we did in great detail. We remember the walking, which helped, not wanting to talk to anybody, only talk to women, very hysterical. And it troubles all, rheumatism, dysmenorrhea, head, hiccups, stricture, so many things. But it is also for debauchery. So it is for people who are calm and become rowdy, and the horrible smell, which is again seems to be a Fable's kind of a theme. Kaju Putnam can make you light and happy. Then you have eucalyptus, which we all know how much it can absorb. So Israel used for swarms. And if you are standing there, it could take you in also. So free versus congestion, which is the theme of the whole column. And yeah. So hot flushes, it is useful for. Then you have Vivigium, which we know, and we use it for diabetes. So we've done so many different things here. So here you have slow ejaculation, worse coition. But what we did today was that it's completely completely out for the next one day. Termina Arjuna is like post Cratagus, post Arnica. We also saw my case of chymosis not healing with anything but that. You had the granitum, which was crown, and I'm regal and loyal, something, like the Rosa D. Then your Metis communis we used only for one case, and they haven't got back to us. But here, very low immunity, and for change of every change always gives them a problem. So I've given it for just immunity. Let us see. Then you have pimento, where you are very peculiar. One part is hot and the other as if a cold sponge is applied. Your malacia, which is henna-like, and we saw 2-3 henna stories of, fertility and balance and all that. We had Lawsonia also henna, but more for liver and jaundice and renal. Again, spleen, but in this remedy, we saw it was the hard spleen. Then you had the evening primrose, yellow flowers, but it softens the cervix before birth. So it is for easy labor, also for infertility, and a lot of weakness. It makes the skin also supple. And there is a lot of leprosy, miasm, unwanted, rejected, fear of relationship, so fear of parenthood. So it doesn't do all the things that a woman is supposed to do. So menses trouble, pregnancy troubles, parenthood troubles, so on. Then you had the mitales. You had again the congestion, but here you have the thorns. So you have the Daphne indica, which is the most peculiar, what this dreams of cat. And that is what allowed them to prescribe with terrible headaches. Mesarium, which had the terrible skin. And so that was the main thing about Mesarium, where you had the shame, guilt, conflict, and skin getting affected. Then this is, we've already done primrose. Then you have the Fabes ka some one-liner. Melilotus, which we did a case of, and very, very powerless and fear of poverty. We did that case of the woman, from, she was so persecuted, and she had this deep, deep anger. You remember, came from Germany and ran away, and then came here, and here also they evicted the house. So she has said, I have this deep, deep, anger. I want to blow up the government. Then you have Mimosa pudica, which we said, touch me not. And then you had Robinia, which we did a case today, which was really nice, the malaria miasm. And the case was about even the family breaking up and the father dying. So yeah, and it is more about gases. Then you have tamarind, which is drying up. It's very drying up, but it is a short distance runner, and very nicely it was connected to Bryonia with mature and a long distance runner. This is very apathetic, quiet, angry, and it is connected to a lot of homesickness and nostalgia. And here tamarind is for painful stools and rectal fissure. Then you had Balsama Peru, which we again spent a lot of time. Top 5 allergens for bronchitis, cracked nipple, and chapped skin. Alpha tonic, we spent a lot of time, where the feminine quality is exhausted. So post-childbirth exhaustion, weakness, fatigue, and baby blues. So blue is one big theme of this whole thing. Craving only sweets and gives gas. So yeah. So alpha is something, any of you all have used it? I've used it a lot in this, at least 5-6 bottles we have finished in the last 2 weeks. Then you have the soya, which is again in congestion, swelling, but strong hot flush. So this is in soya, comes in menopause, and it is the maximum protein for vegetarian. Then you have lathyrus, which again, we have given it to one patient of paralysis. So we'll let you all know. Harsh condition. It has a neurotoxin and gives paralysis of the lower limbs, hopeless, syphilitic, can't cope. And cold towel on the abdomen helps. Better lying, because it can move its legs side to side. It can't move its legs. So it wants to lie down and not cover and then be able to move. abused, separated, but needs to live in the family, which is again a fabulous theme. Then you had Kopaiva, again a very good case, but it had horrible stories, aggravate, and very self-critical. And black sheep maybe also hide, lot of hide desire to, lazy, aversion to work, not ready for a relationship, makes mountains out of molehills, small things, and then broods and broods and broods and broods. So yeah. Then you have acacia spigel, which we talked about the ark, maybe that ark was built from it, and the wood is very, very tough, unprepared to die, suffering but afraid to die. So we have some remedies which make you prepared for dying, like Rosa Canina also does. So mother is afraid that the world is too dirty and doesn't want to bring the child in. Okay, it is very perfectionist, must complete one stage before the next, obscure. So all the exit points of the soul are affected. So nose, throat, breath. So sacredness, acacia sacral is about sacredness. So exit point of the soul. So let us. Then we did baptisia today, scattered, despair of recovery, syphilitic miasm, thirsty, chilly, gelsemium no thirst, that body exhaustion, and does not know how to enjoy life. So that is all I have for you today. And the other remedies which you've done today, I'll put it in the one-liner for next time, right? So we've done quite a lot.
Yes, madam. Thank you so much. Thank you. But
Thank
what
you.
I find this acacia, what you told, no, it is a shikakai. Acacia is a shikakai plant.
Okay, maybe. I'm not so sure. Let us find out. So we have done Roselle's 15, Myrtle's 14, and Fabio's we're going to do 18. So that's quite a lot of remedies we are doing, right? 48 remedies, yeah. Think 48 remedies, which half of them we never knew or heard of before. So I think it's quite. Thank you, Dr. Vibha, for
Thank
you.
you.
over 5
Thank
o'clock.
you, ma'am.
We're going to finish 10 minutes earlier. Yeah.
Thank you so
Thank
much.
you. Thank you
Thank
so
you.
much. What a wonderful session. Thank you.
Thank you. Thank you.
Bye-bye.
Thank you, madam.
Thank you, Nirupama. And Nirupama, next time we must have some more cases. You're a good coordinator. Very good. Thank you so much.
Thank you, madam.
Thank you, ma'am.
Thank you.
Bye. So Tabusam, are you enjoying the sessions? Samahita, Tabusam, my old friends. Priti, you can unmute them. They want to say anything. You can stop the recording. Yeah. Are you finding it any useful in practice, Tabusam? Okay. Do share. Weimer, you're enjoying yourself, I hope. Okay. Thank you all. Bye. Thank you, Fatima, for everything.